endometrium is not only good in morphology, but also good in color flows. So I do a lot of Dopplers, but I leave it to you. I love my 3Ds. You should also do a 3D to see that cavity is fine. Uh, Histoscopy, I don't recommend at all. I like to ask you people, how many of you do screening histoscopy for all the cases? Many
No,
people do.
sir.
So
Not now, sir.
not now, not now. It should not be done. It's not an indication.
Not doing so.
Not doing.
Only if there is failure.
Yeah, even in failure
Previous
is not
failures
recommended.
we used to do, sir. Previous failure.
Yeah, so good, so good. I'm good with this information. Coming to the procedure, we should we should do. See what happens. One thing I hate is that we all treat women as if you just like a. I feel very bad. You just take a catheter and put inside her urethra and bladder. You shouldn't be doing that. You should never catheterize a woman without her consent and never catheterize without any indication. So we should get the woman in the OT after seeing her bladder. Don't just get into the OT and then they say bladder is more full. Catheterize come. Or bladder is less full, give retrograde bladder filling. Many people do this. So don't do such a thing. Never catheterize a woman is the answer I'm giving it to you. Never catheterize a woman. Avoid catheterization, not avoid else and never. Once in a while it happens, it's okay, but don't catheterize a woman. You give her infection. Many people flush endocervical and endometrial cavity prior to ET. Never do it because this will take the debris in and cause more problems. Pain relief and uterine myolaxants not to be given as a routine, but when the patient is anxious, do give. Antibiotics not to be given routinely. They can have antibiotic resistance. In case indicated, you may give, but there is no clear-cut answer over this. It's your choice. The most important part is the USG settings, depth, focus, zoom, artifacts. What is an artifact here? I want to ask you, what type of artifacts do we get when we are doing an embryo transfer? What artifacts we get? Depth, zoom, other things you already know. But what is an artifact? भूल गए सब लोग? Artifact is some sort of an reverberation. Have you forgotten that I
Revelation,
told
sir.
you what is a reverberation? When
Your voice is
I'm saying reverberation.
When images, two images are forming at once of one.
Exactly. So that's a reverberation. Remember, Shivani, we have spoken a lot on reverberations. So reverberations occur. So reverberations just give you a mirror image. That's an artifact. And how do we change? How do we come out of the reverberating mode?
Moving a probe a little and
क्या बात है?
changing.
Who said that?
Sareshna, sir.
Ishna. Ishna, where are you?
So right now I'm having fracture of calcaneum at home.
Fracture calcaneum. What did you do? Whom did you kick?
Fell down from stairs.
Okay. How's mummy doing? Okay.
Yeah, she's good. She's good.
Good. So hygiene, wearing a glove, mask and cap is a must. So debate comes about should we use powder-free gloves or not? I think there have been multiple studies. They say it doesn't make a difference, but I think it makes a difference. Always you use powder-free latex gloves. Never touch with the powder gloves the catheter. So this is, but always take all care. And types of catheter used, we should have all type of catheters. We should have a catheter which is outer and inner, always, or and one with a stillet. So the people who come for the hands-on training, we showed them the stillets of stainless steel, which we can weave through the cervix. Operating room is important. Equipment and consumables are important, which we have to see before. And so now I am focusing on the procedure itself now when the work has started. So we have to set the machine on depth, focus, zoom. And what is the most important thing when we do an ultrasound or embryo transfer? What is the main setting where people go wrong? Anyone?
Zoom.
Not zoom. It is the patient.
Ecogenesis.
She may be on an op setting, abdominal setting. Abdominal gynae, and we are doing a pelvic gynae. Uh, so we have to see that whatever scan we are doing is an abdominal or a pelvic scan. Accordingly, we have to set our machine. A full urinary bladder means what? It's not full. It's what patient want. It's a comfortable uh, urinary bladder which she wants should be given to her. Removing mucus from the cervical canal is always debatable, uh, but you can remove it. It doesn't do any magic, but it is plus minus. It's plus minus. Disinfection is big no from my side. We never used any iodophores ever. And patient positioning is very important. So make her comfortable. That's very mandatory for us to make her comfortable so that she's lying down in a very relaxed position. And I always say that always give them some menu card of music, whatever they want to hear. She may like Radio Mirchi, or she may like to listen to any old ghazals or some spiritual songs, but play what she wants to listen to.
So
Maximum.
one question, sir. So
Good.
we give vaginal progesterones before, like from 5 days before we start giving
Yeah,
vaginal
fine.
progesterones,
Okay.
and during ET we have to clean all that.
नहीं हम वेजाइनल देते ही नहीं है मतलब दे सकते हो वेजाइनल बट केस यू गिव वेजाइनल देन नहीं पर आपको वेजाइनल थोड़ी क्लीन करना है अगर आप वेजाइनल दे भी रहे हो यू
Yes,
डोंट हैव
sir.
वेजाइना यू हैव टू जस्ट क्लीन द सर्विक्स
Okay, just the cervix.
सर्विक्स यू नेवर क्लीन द वेजाइना क्लीनिंग इज नॉट अ जॉब
Okay.
नेवर ड्राई क्लीन द वेजाइना को छोड़ दो just hold the cervix and just gently put a gauze piece here and spurt some fluid media and then
So the three swabs you
Two,
told. Like,
here always 2 or 3 swabs you take and don't try to put a swab stick inside the cervix. Never do that. You'll push it.
okay.
The time of loading to embryo transfer is how much? Who will tell me?
90 minutes.
No, it
And
90 minutes.
नहीं, sorry.
तू आराम कर रही है तू 120 seconds 120 seconds
Less than 1 minute.
less than 1
1
minute
minute max.
less than 1. Great. So 3D of ultrasound we normally don't do, but we don't do 3D guided embryo transfer, but 3D should be done before we do the embryo transfer and time interval before withdrawal. So they say that total journey from loading to expulsion should be less than 1.20 minutes. यानी कि 1 minute and 20 seconds, 120 seconds. And then after we have expelled, some people like to wait. They like to wait for things to settle down. Yes, you can count till 10 and take it out. That's what I do. Don't wait for more than that. After you expelled gently, then see the embryos settling down and then keeping the plunger pressure on, rotate the catheter and take it out. This is what I tell all of you. All of you girls
Yeah.
like this simple answer. And then coming to the OT
Radhe.
temperature is 22 degrees centigrade, which you already know. And the OT lights have to be put off or kept away from your focus. And OT and lab temperature is at 22 degrees centigrade. So be very careful that don't handle the catheter in the OT for a long time. So an embryologist should get the catheter. The catheter, when the outer should be put by you, and the catheter should also be inner should be handled by you. I think a lot of you people are handing over your catheters to an embryologist. That should not be done. Pushing is your prerogative, not of an embryologist prerogative. So you know where to push. So always put outer yourself and inner they will give it to you. At what point of time you will make noise?
तुम खाओ तुम्हें अच्छा लगे तो
At what
When
point?
we cross internal walls.
Yeah. So how do you know that it is crossing the internal loss?
See through the skin.
the first black line when it
First black
passes
line.
through the
Yeah,
outer
first black.
catheter.
Who said that? Who said that?
The Dr. Ruby sir.
हाँ रूबी ग्रेट रूबी कोलकाता वाली है क्या हिसार
जी
वाली
सर, जी सर,
कोलकाता वाली है हिसार वाली
जी सर, नहीं सर, कलकत्ता वाली सर.
वेरी गुड
So we are batchmates, sir. Ruby and me are batchmates.
Yes sir.
ओके ग्रेट
I was listening to Ashna. I thought I'll message her after some time.
okay both are talkative इसीलिए so this is how it goes in. This is not my picture. Not my picture. I've just taken a picture from the net pic. Normally, I use only my picture. This is net picture. And it's from one of the catalogs of a very leading manufacturer. Very nice picture they have given. Uh, Bladder, air bubbles, ET catheter, and they have expelled it like this, going like this, expelled it somewhere around 1 centimeter below the fundus. The catheter is being withdrawn and the game gets over. Now, coming to the embryology part, I always prefer to load embryos by sandwich technique. Now, what is sandwich technique, anyone? What is the sandwich technique?
Sir,
So
embryo with
bottoms of
layer and
air
layer
bubble
media.
media,
Embryo in between.
media.
Yes.
and
Yes. Very good. Very good. I prefer sandwich
So
technique.
in between air bubble embryos with their load, and that is called sandwich technique.
Absolutely correct. Absolutely correct. Now, embryo glue के ऊपर just some recommendations are there which are more positive that embryo glue will help. So in case you have a difficult case, use embryo glue. Don't use for all. It costs a lot of money. Don't use for all, but you can use embryo glue. SCG supplementation in the media, not recommended. And then at the end of the procedure, post-procedure care. So can someone tell me what care we take after the embryo transfer? What care we take after an embryo transfer? I want to ask you.
So we have to
Try and
tell
be
the
present.
embryologist to
Talk to
see
the
the
patient. Counsel the patient. Make her
see in the
comfortable.
microscope.
Talk to the patient. Talk to the patient. Don't just walk out, which I normally many times do. Talk to the patient, spend some more time with them, counsel them, and they can walk down. Can they walk down from the OT table and go home, or you want to keep them under rest for some time, half an hour?
15 minutes.
Walk out. Can walk out.
10 minutes is
All right.
10
enough.
minutes.
Afterwards, they can walk down, walk out.
Walk out is the right answer.
Hmm.
Right answer. The volume of media to be loaded in catheters is around. So, see, what is the ideal? What is the ideal, or why do we take? What volume should we take to push the embryos? We should take minimal volume or more volume. I want to ask you.
Minimal volume.
Minimal volume.
Minimal volume.
So that's the wrong answer. It's not the minimal volume. We should take some volume between around 20 microliters approximately, so that embryos are getting nutrition and the warmth of the media for some time. So minimal matlab some people want to load embryos dry. ऐसा नहीं होना चाहिए. Take around 15 to 20 microliters on average for you to get a better outcome. And that's the way many people load. They load media with an embryo. They load media with an embryo into air columns. It's called sandwich. I love this technique. I love this technique. And then they load some medium in the end. So whenever I do an embryo transfer, I always take some media in the end so that I get more comfortable feeling that I push in some media first and then I push the embryo in two air columns. So my technique is sandwich with some media in the front. This is what I do. Uh, no technique is a super technique. All techniques work well. Post-procedure, intercourse, and bed rest procedure. So what do you talk about, say about intercourse after embryo transfer? Yes or no?
No.
No, abstinence for
No,
50
sir.
days.
No,
So
sir.
again, debatable hai. Debatable hai. They say that it can debatable. It may induce uterine contractions, but many people don't say no. It's plus minus. But in case you ask me what